There are two things to consider when it comes to mental health. Two questions that you can ask yourself or someone else that are so important. In this video, I'm going to explain what they are and why they may even help to save a life. So stick around to listen and learn. Hi guys, I'm Lane, your doctor on demand for down-to-earth health education designed to help you feel good about yourself. Mental health is one of the most common issues we encounter in general practice. Yet research shows there are still far too many people who are struggling but don't reach out for help. So in today's video, I'd like to tell you a story about when I was a teenager. I was very fortunate to grow up in a wonderful family. I had a very happy childhood. But during my teens, particularly when I was about 15, things started to get pretty tough, particularly at school. In fact, for about 9 months, I struggled with low moods and crippling anxiety. I was having panic attacks almost every day at school, and I was not in a good place. Now you might be thinking, oh, he must have had depression and anxiety. And look, to be honest, I have no doubt that I probably would have met the diagnostic criteria for both of those things. But the point is, the real question shouldn't be what was my diagnosis or what was wrong with me. The real question should be, how was I feeling? And how was the way I was feeling affecting my life? Discussions about mental health often become dominated with words such as depression and anxiety. And look, this is not a bad thing, but sometimes it can be a little distracting and even confusing for people. For example, I've had multiple patients say to me, well, how do I know if I'm depressed or just sad? How do I know if I'm stressed or if I have anxiety? Is depression a mood or a diagnosis? Is anxiety physiological or abnormal? So what I say to them, if you're feeling sad to the point that it's affecting your life, does it matter if it's depression or not? That'd be like saying a headache's only serious if it's caused by a brain tumor, or a sore arm is only an issue if it's a broken bone. I want to make it simple. When you think of mental health, there are really just two questions you need to ask. How are you coping internally, and how are you coping externally? You can think of it as the two F's, how you feel on the inside and how you function on the outside. So going back to my story, how was I coping internally and externally? Well, externally, I did a pretty good job of hiding how I was feeling because to many people, my functioning probably seemed unimpaired. I was still going to school, getting reasonable grades, handing in work on time. I even would go out with friends, even though it would mean putting on a happy face from time to time. That said, I wasn't eating much, and as a result I was losing some weight. I wasn't sleeping very well, and to those around me, I probably appeared to be quite moody. How was I coping internally? I was in a very dark place. At my core, I was struggling with my identity and self-esteem. And if I'm totally honest, I hated myself. I hated how I looked, I hated how I acted, I hated how people saw me or how I thought they saw me. Yeah, internally I was lost, scared, miserable, confused, exhausted, and lonely. Yeah, one of the things I remember most about this time was the loneliness, the feeling that nobody could help me, that nobody knew what was going on. But in fact, this was not true because my family and closest friends did notice that something was different, and they did the best thing that they could have done. They reached out and asked if I was okay. And you know, even though I lied and I said, yeah, I'm fine, the fact that I knew that they knew meant that I didn't feel alone. This is why it is so important to never assume anything and to remember that talking about how we are feeling should become a normal part of our day-to-day dialogue at home, at work, at school, and with friends. The more normal it becomes to talk about feelings, the less awkward it will be if you or someone else close to you ever feel you need to reach out because you're struggling. I encourage you to change the way you think about mental health. Rather than worrying about diagnoses or explanations, just keep it simple. How do you feel and how are you functioning? Recognizing when you or someone else around you is not coping as well as they normally would, regardless of how that presents or whether there's a diagnosis underpinning it or not, it can be the first step in seeking help. And I can't stress enough how important it is, not only to speak up if you are struggling, but to listen and observe the people around you in case they are. When you rethink mental health using the internal-external coping framework, it's amazing how you start to notice little things in the people around you that might just be different. Now, don't get me wrong, a lot of the time it might just be somebody having a bad day. But even if it is, a simple gesture or a kind word to show them you care is never going to go astray. And if it is more than just a bad day for that person, reaching out and showing them you care could make all the difference. In some cases, It could even save a life.